Hey everyone, this is Jacqui Cooper with JCooperTravels, and today we have a really important conversation that I'll be sharing with you in a quick second. For those that have not had the pleasure of listening to the ongoing talk shows over this past year, JCooperTravels has evolved from travel in general, like where do we go physically in travel, to how do we travel in life. And that covers both what are we doing in our career, what are we doing personally, how do we interact with friends and family, as well as where do we go for our leisure and our enjoyment. Today, I have a really important conversation for those that are in business, for those that use the services. I met this gentleman and this company on Alignable. I'm networking on LinkedIn, Facebook, Alignable, and a lot of other platforms, but Cal's company is associated with a really important topic. It's all about health insurance 2.0. And these days, especially after COVID, especially after how we have navigated from being virtual to hybrid to possibly in person and all the other combinations in between. There's a lot of questions involved with how do we navigate this change of workplace and how do we support everyone in their health insurance needs. So I'm going to have Cal introduce himself and his company because it's a very important conversation. We definitely need to always be thinking about how do we support ourselves through health insurance as well as those that we work with. Cal, how are you doing today?
I'm doing well, Jackie, and thank you so much for having me on your show.
Yeah, as we talked about offline as well as, on multiple conversations, health insurance is critical. I mean, there are some individuals that don't have health insurance. There are those that might not have enough health insurance. And then there are the companies that also provide the health insurance. And so there's so many different questions that we can talk about today. What is the topic that you would like us to focus on today?
We just started a new podcast series where we're talking about the evolution of the modern workforce. So essentially, in a nutshell, with the pandemic, there's still a risk of for employees out there, even though the vaccinations have been rolled out. So more businesses than not are stating that the vast majority of their hires are going to be done completely virtual. And that's an evolution that's never, ever happened or would have never been contemplated otherwise. And so it's going to be a real challenge for, small businesses and large businesses, as a matter of fact, all businesses that are going to hire with remote employees to be able to integrate that into their culture. So what we wanted to do is develop a platform to help administrators and HR be able to integrate these employees and provide the same level of benefits as in-office employees, because truth be told, there's a lot of administrators or HR managers that are spending an awful lot of time dealing with ancillary issues with group health plans. So the 2.0 aspect allows us to take all that time off their hands, allow them to have more time for other tasks, and provide that white glove service for their employees that's likely missing in their plan right now.
I think that's really what you said is so critical. Time is a commodity that we cannot get back. And with time, we're all multitasking in different ways. But if you can streamline what you're doing in a way that also continues to provide the quality of support and services to those that you're trying to help, one, it makes your time more efficient and effective. And then two, for the employees and staff that you're working with, it gives them the support that they need because, it's so frustrating when you can't get answers or you can't get the support, that just kind of demoralizes everyone. So this is really essential. So what does the portal provide? You had talked about education and documents, but what does the portal provide and how can it help streamline the individuals that might want to use you?
Okay, so it works in a couple of different facets. First and foremost, it provides a total and effective way of communication. So um, traditionally, when, for example, if a company's gonna roll out or replace a group health plan, the administrator would pass out applications, they would fill them all out, turn them back in, and they'd have to follow up and update the employees, ask questions, and it's kind of quite a mess. So if you can imagine, if you have 30, 40 employees you gotta keep track of, it can be pretty burdensome. So what we wanted to do is we wanted to integrate all of this electronically to where we can send out the applications electronically, keep track of each and every process, allow the administrator to oversee and set up the parameters of that portal that they like. And what's really great about it is that the employee can access all of this straight from their smartphone. They can even have access to unlimited teledoctor visits straight from their smartphone as well. So this allows real-time conversations to be able to help the employees moving forward. And then there's one other aspect that we provide that our competition is kind of behind on a little bit, and we have an outside the box approach where the number one issue with group health plans is dealing with claims or overpricing or unfair medical billing. So what we have is we have a medical billing specialist on staff that's proficient in medical coding and also balance billing. So that's a whole different language. It requires a whole different set of eyes, a whole different understanding of that back end process. And so what they'll do is an added white glove approach is they'll reach out to each and every employee, tap them on the shoulder and say, hey, who's your doctor? We'll go ahead and let them know in advance and set the coverage up for you, which will eliminate 70% of the issues moving forward. And if there ever is a billing issue, our medical billing specialists will jump in and make sure all the codes are correct and be the liaison, so to speak, between the insurance company, the administrator, and the employee, and helping take all that time and burden off the administrator's hands.
Yeah, no, that is critical, because also when you are a staff member, an employee, and you are in a medical situation, you want to make sure all that information is correct, because you're not thinking about what the numbers are. You just want to get healthy and taken care of. And so if you have someone in your system that actually can take care of all the other nitty-gritty details, then it means that everyone in the whole network is happy. And it also means that the HR person or whoever's using the service isn't getting bogged down with the minute details, that there's someone else there to support. So go ahead and share your website. That's for those that aren't familiar with talk shows, there's a little block below, and the access information will also be there in case you don't have paper and pen now. But go ahead and share the website. So if people would like to check out and see what the services are and how to integrate that, go ahead and share it.
Yeah, it's bettergrouphealth.com. And that'll take us to our main portal. It'll give more about the medical billing specialist and, added detail that'll kind of create some more transparency to this conversation.
Why don't you repeat that one more time in case people didn't write that down?
Sure, bettergrouphealth.com.
That's great. So I know we're going to be talking more about health insurance 2.0, but you're located in what part of the country?
We're in Austin, Texas. It's if you haven't been to Austin, Texas, I'd highly recommend it. There's some pretty cool attractions. One of them is one of my favorite is actually coming around the corner in August, where the Mexican bats leave the Congress Bridge, like right on the cusp of downtown, right over Lake Austin. And there's like a huge crowd that watch these hundreds of thousands of bats kind of migrate out.
Wow.
It's quite the spectacle. It almost blacks out the entire river below it, which it's called Lake Austin, but it's really a river that goes through the center of Austin. So it's really, really neat. And of course, there's South by Southwest. It's the live music capital of the world. And then one other little tidbit that no one really talks about in Austin, which I think is awesome, is that there's a main highway that kind of lies on the west side of the city that runs north and south. And it's called MOPAC, and it's based on the old Missouri Pacific Highway, right? And so what they've done is they put an ordinance where there is no advertising allowed at all. So the only signs you're going to see are the mile markers and of course the exits. And it has beautiful views of the rolling hills and of course the lake. And then it runs right next to the skyline of Austin, Texas, which is probably 10 times the size when I was living back here in the early mid 90s. So it really is it's a beautiful city. They've done a really good job on trying to incorporate that. And it's like I think there's 300 people a day moving here right now. So it's like a big tech hub. So yeah, I love it here. And as far as our client base, we're in several states. We can work coast to coast. And so yeah, that's where we're at in just Capital Texas.
I love it. I love it. I haven't been. It's on my bucket list to come and to check it out. So have we covered everything with Health Insurance 2.0, everything that you might want to share? I know that we have talked about how the nature of working at home versus in the office is also changing the complexion because of sometimes the legality of of just saying, okay, well, is this injury something that actually falls under corporate health insurance because you're working from home? So you want to talk about a little bit about the challenges faced with this kind of blended work environment?
Yeah, no, it makes sense. Yeah, it's a great point. And yeah, I do want to address that. So, it's no secret that the Affordable Health Care Act has had its challenges in the past, right? So, a lot of insurance companies have kind of struggled to maintain any profit balance, over the last several years. So unfortunately, they've retracted a lot of the resources that administrators are now trying to fit in. So a lot of people kind of view health insurance almost like a seasonal event to coincide around the open enrollment for individuals, like through healthcare.gov. So, and we really did feel that pain. We understand all that. And so that's where we came up with the ideology saying, look, if the number one issue is the lack of time, taken away from these human resource administration, and it's causing a kind of more of a frown for employees just because of the delays that they're speaking to, then we wanted to provide resources on our own, which is where the medical billing specialist came from, to be able to set their services apart. And part of what we see with our services and the feedback we're getting is that there's more time for administrative personnel, which in truth kind of gives them an edge in recruiting and allowing to offer benefits that employees can't get across the street. After all, the number one consideration for a new employee is the health insurance benefits that are being offered. So we really want to stand apart with that. And so our thinking is that when these new remote employees start arriving, that's a bigger pool to choose from, and trying to get employers to attract more talent. And we want to coincide with the benefits that walk hand in hand with that talent to bring that added value back to that institution. And so that's what we're doing. That's where, you and I cross paths on Alignable, and we're all over LinkedIn as well and Facebook. And we've been at this for quite some time. So that's where the element of that 2.0 really comes in, is the clear transparency of communication, and at the same time offering those added benefits that really sets apart that white glove service that's what's what I'm looking for, drastically missing from the market right now. And so that's what we're filling in. So yeah, guys, please check us out, bettergrouphealth.com. You can reach out to us straight from there. You can also find us anywhere on social media. We're CustomInsured. So yeah, please check us out. But yeah, that's what it all kind of sums up to, and the benefits that we want to provide for the employers that we work with.
I think, I'm real excited to have made the connection with you. And I also think that COVID has changed how we look at our work environment. We realize that we can move some of our work to our homes, and we can also go ahead and be back now in the workplace. And because of the virtual aspect of it, I mean, I know I have multiple hats. I mean, I am a special ed teacher, so I had to learn how to navigate teaching kids through a Zoom environment, and they actually thrived because they're like little sponges. I think it was more for the teachers that had the struggles of trying to figure this out. The kids, are very flexible, and they're little learners, so they just love learning everything. But I think, again, I navigated to special ed from law. And because I always looked at law as a tool, and I knew that even after I retired from special ed teaching, I could become an advocate for children. But even in doing that, I'm realizing that some individuals, some businesses that I associate with, they also don't have the basics for their small business. So, as we've talked about, I've become associated with Legal Shield because I'm licensed in one state, but now with Legal Shield, I actually am able to refer people to all 50 states, to Canada and the UK. So small businesses can actually be covered. I mean, also individuals who need a will or identity shield, you can think about doing these things. So on the one side, you have the business that you, Cal, are talking about with the health insurance, which everyone needs. And then on the other side is what I'm just sharing about Legal Shield, which everyone needs a will, and everyone needs to think about, how do you protect yourself? And the monthly, the plans are as low as having a cup of coffee at Starbucks every day. So again, these are things that I think everyone needs to think about, because whether it's travel insurance because of my traveling, to legal, to healthcare, these are the three things that everyone needs to be thinking about. You can't, if you cut costs in certain areas, you end up paying for them later. So it's much better to be preventative in the health side and use someone like Cal and his company, just like using someone like Legal Shield for a will, or getting travel insurance, to think about what happens with the unexpected when you take a really great trip. These are small costs and investments that I think have great returns. So Cal, why don't you go ahead and share again, your website, and so people can connect with you. Again, all this information will be in the podcast below, so people can, if you don't have paper and pen, you can actually just visit again and be able to connect back with Cal. Go ahead and share your website one more time.
Sure. It's bettergrouphealth.com. And Jacqui, real quick, I just want to kind of throw a couple of 2 cents on that. What you're saying makes a lot of sense. And what we're seeing is a lot of businesses are starting to grow, and they maybe have had one trusted advisor. And then what happens is they start venturing into areas that's not the expertise of that advisor. And then therefore the services get watered down, and that's where your troubles can escalate. So yes, it is very smart to try to integrate these services together. And especially when you can combine the services into one, which, like, you and I work together, and then there's other people that we work with on the payroll side to integrate all these together. Because that evolution of the workplace, the workforce employee, is bigger than all of us. It really is. And so I think that it's something that if you don't plan for it in advance, it's going to be a lot messier when it does hit, So I think that makes a lot of sense. That you want to expand your horizon. You want to look to people to integrate that and not have a watered down system, so to speak.
Yeah. And also because if your primary business is not health or law or travel insurance or insurance of any type, you want to do what you love, what your passion is, and you want to have and be successful at that. And so anyone, whether it's myself, whether it's Legal Shield, whether it's Cal's company, we're part of your team. We're the team that might not be directly on payroll with you, but we're part of your team to support your vision and your passion. So just like you said, Cal, it's important to think about who are the diversified experts that can support you and your vision and your dreams. So again, everyone who's listening to the talk show, just kind of do a self-assessment, your own business health check, to see, do you have all the pieces in place? And if not, just reach out to any of us for complimentary consults, because that's why we're here. If we don't fit, you won't use us. But if we do fit, then maybe we can help you with having your business become more successful. So any last minute thoughts, Cal? Because I've really, you and I've had many conversations and I've enjoyed each of them.
Yeah, no, yeah, and what you're saying makes perfect sense. I guess on the last thought is that if you do reach out, we understand that we're not a fit for everyone, and there has to be a mutual interest at the very least. Or maybe we're able to point you in a different direction you didn't know was there. So, I agree with everything you said, and hey, thank you so much for having me on your show. It's been a pleasure.
Yeah, no, I look forward to our next conversation. So everyone definitely like and subscribe and check out the future talk shows, but definitely reach back out to Cal or myself. We're here to help you because that's what's exciting about networking on LinkedIn and Alignable and all the others. There's so many creative people in all these different businesses, and we're here to support each of you. So thank you so much. Have a great day.